Ultrasounds should be performed in a case-by-case situation. There is no normal number or abnormal number of ultrasounds, that are performed during pregnancies. In an uncomplicated singleton, which is just one baby inside of the uterus, patients can expect anywhere from 2 to 4 ultrasounds. In a case where we have multiple gestations, 2 babies, 3 babies, 4 babies inside of the womb, obviously a much higher number of ultrasounds. On that initial visit, like I stated, I like to ultrasound my patients. They are usually about 5 to 6 weeks pregnant. At that point, we can identify how many babies are actually inside of the womb at that time, if it's a single pregnancy or if it's twins. We can also estimate how old the baby is. And the earlier the ultrasounds are performed, the more accurate the dating of the baby's age is. After that initial ultrasound, at about 12 weeks, we also recommend an additional ultrasound, which evaluates the nuchal translucency, or the thickness of the baby's neck, as well as the presence or absence of a bone in the nose called the nasal bone. These two parameters have an association with syndromes like Down syndrome. So we can also, as early as 12 weeks, with the inclusion of this ultrasound and a blood test, we can let patients know if they are at a higher risk for a baby with Down syndrome, or if it appears that their risk is very, very low. And this is something that is relatively new, where patients as early as 12 weeks are informed that their babies may have or may not have Down syndrome. We then repeat the ultrasound at about 16 to 18 weeks, which is when we do the entire anatomical evaluation of the baby, making sure that the organs like the heart, the brain, and other organs are forming adequately. And then in some cases, we may do an ultrasound towards the end of the pregnancy to make sure that the baby is either in the head first position or in the sitting position, and as well to follow up on the baby's size and estimated weight at the time of delivery.